Hi, I'm Dr. John Young, the medical doctor here at Foundational Health Center here in Largo, Florida. And today we're going to be talking about a topic that in my early training, in my practice up until last year or so, I hated to talk about. It's the neurological diseases. Lou Gehrig's disease, it's also called ALS. Any of these neuropathies, where the brain just kind of falls apart. And you can go to the neurologist and you get some fancy diagnosis, but there's really no treatment. And it's discouraging when you've got a patient where there's really nothing out there to do for them. And over the last several years, Alex and Tiffany and I have been working at just trying to get more information on these neurological diseases. And as we've been studying, we've come across a couple kind of principles. And it seems like most all the neurological diseases, they have a problem with the buildup of mucopolysaccharides in the cells there in the central nervous system. And mucopolysaccharides are controlled by the thyroid gland. And these mucopolysaccharides, you get too many of them and they destroy the nerve tissues. So in looking at patients that come to us with these debilitating neurovascular or neurological diseases, there's a couple basic things that we do. Number one, we always get a vitamin D level. And we like those D levels to be high, up around 100 or even higher. Because there's a strong correlation to a lot of neurological diseases, such as MS, and low vitamin D. Number two, we want to check the thyroid. And we will get the blood work, free T3, T4, TSH. But we also want the basal body temperature, that first temperature in the morning when you wake up, don't move, put it under your tongue. That's the temperature we want. Because if that temperature is low, we know that the thyroid is not working correctly and you get increased mucopolysaccharides built up. And that's how we follow them. We'll put them on thyroid medication. We like Armour Thyroid or NP Thyroid or, bioidentical thyroid supplements, and we follow that with the temperatures. And then we like to get a fasting insulin, not glucose, insulin level, because that also helps with looking at how insulin does cause damage in these neurological diseases. So you want low insulin levels. Now, I'm going to talk about a patient that I first came across 2 years ago. A gentleman about 45, 50 years of age and diagnosed with Lou Gehrig's disease. And the University of South Florida worked him up, finally came to that diagnosis and basically said, John, there's really nothing we can do. You can try to get in some experimental study, but even those are few and far between. We can get you into a support group and, we'll just check you a couple times a year, get some labs, and really just kind of watch you waste away is basically what they were saying to him. So he came to us. And when I first met him, it was hard to understand. Luckily, his wife was here because the muscles were so weak in the jaw, it was hard to understand him. A lot of fatigue, needed a walker. So really losing the ability to even move about. And in his talking, it was just, I'm thinking, this is going to be a long, long visit. So we started with some basic things. And we started to get the thyroid right. Started to work on the thyroid. I gave him umbilical cord stem cells because there's some interesting studies out there with umbilical cord stem cells and a lot of these neurological diseases. because these stem cells also have cells in them called periocytes, excuse me, that are very specific for the nerve conduction in the central nervous system. So we gave them umbilical cord stem cells. We gave him Enbrel, which is a drug that you use for psoriatic arthritis, but there's an off-label use of it where you just give it at the base of the neck, just under the skin, like a TB tetanus shot or a tetanus shot, just right under the skin. And we gave him that because it stops inflammation within the central nervous system almost instantly. Because we're trying to decrease the inflammatory aspect. We also put him on something called fulverine, which is just like a super antioxidant. It just works really well at kind of looking for all the debris, all the cell breakdown, and getting it out of the system. I put him on our protein with a lot of omega-3s because I'm also trying to rebuild that myelin sheath, the insulation along all the nerves, trying to rebuild that. And over these last 2 years, it's been really encouraging, both him and another patient, similar patient, seeing these two patients with ALS actually get better. The one gentleman, I can actually talk to him now. I don't have to, his wife is not there having to explain everything or because I can't understand him. I can understand him very clearly. In fact, he said recently, I can now go over visit with my mother and I don't have to bring my wife along because she can actually understand me now. He's back in his workshop around power tools because he's strong enough. He has good coordination that he doesn't need his walker. He can use his arms, which were getting weaker and weaker. And he's doing stuff that he couldn't do in years. And he's also noticing that he's actually gaining muscle mass. And so what I'm saying is, I'm not saying that we have the cure for anything. But I'm saying if you go back to basic physiology and biochemistry, and you break down these diseases, instead of just looking for a drug to throw at someone, maybe actually break them down biochemically, genetically, there's a chance that you may be able to get these people better. We have 2 patients that have done extremely well, but talk to your doctor and ask him to look at you biochemically, do urine organic acid tests, maybe consider stem cells. There's a number of things to look at, but ask them to don't just look at me as a person where we need to find a drug to cure him, but can you actually make me better just using basic biochemistry and physiology? I know that I have 2 patients that are very, very happy that we've looked at them like this because the disease that they told was, you're just going to get weaker and weaker and die. That may not be true.